Let's begin our discussion by studying the structural boundaries of the femoral triangle. Femoral triangle is a triangular depression on the front of the upper one-third of the thigh immediately below the inguinal ligament. As for its boundaries, the femoral triangle is bounded laterally by the medial border of sartorius and medially by the medial border of the adductor longus muscle. Its base is formed by the inguinal ligament. The apex, which is directed downwards, is formed by the point where the medial and lateral boundaries cross. The apex is continuous, below with the adductor canal. The roof of the femoral triangle is formed by skin, superficial fascia, containing the superficial inguinal lymph nodes, the femoral branch of the genitofemoral nerve, branches of the ilioinguinal nerve, superficial branches of the femoral artery with accompanying veins, and the upper part of the great saphenous vein. Deep fascia, including the cribriform fascia covering the saphenous opening. The floor of the triangle is formed medially by the adductor longus and pectineus, and laterally by the psoas major and iliacus. So, to summarize, the lateral wall of the femoral triangle is made up of sartorius muscle, while the medial boundary is made up of adductor magnus muscle. The base of the triangle is formed by the inguinal ligament, while the apex is the point where both the medial and lateral boundary coincide. The roof of the triangle is formed by the layers of skin and fascia, and the floor is formed by fore muscle, part of the adductor longus, pectineus, iliacus, and psoas major muscles. You can pause and review the boundaries of the femoral triangle in this tabular form. Moving on, let's look at the contents of the femoral triangle. The contents of the femoral triangle are as follows. Femoral artery and its branches. The femoral artery traverses the triangle from its base at the mid-inguinal point, the apex. In the triangle, it gives off 6 branches, 3 superficial and 3 deep. We will discuss these branches in detail at a later stage. Femoral vein and its tributaries. The femoral vein accompany the femoral artery. The vein is medial to the artery at base of triangle, but posteromedial to artery at the apex. The femoral vein receives the great saphenous vein, circumflex veins, and veins corresponding to the branches of femoral artery. And as you can see, the femoral nerve also transverses through the femoral triangle. We will get into detail of the nerve, but first you should familiarize yourself with another structure found in the femoral triangle, called the femoral sheath, is also found in the femoral triangle. It encloses the upper 4 cm of the femoral vessels. This is a funnel-shaped sleeve of fascia, enclosing the upper 3 to 4 cm of the femoral vessels. It is formed by downward extension of 2 layers of the fascia of the abdomen. The anterior wall of the sheath is formed by the fascia transversalis, which lies in the anterior abdominal wall deep to the transversus abdominis, and the posterior wall is formed by the fascia iliaca, which covers the iliacus muscle. Inferiorly, the sheath merges with connective tissue around the femoral vessels. The femoral sheath is asymmetrical, its lateral wall is vertical, and the medial wall is oblique, being directed downward and laterally. If we look at it from this angle, it is clear to see that the sheath is divided into the following 3 compartments by septa. The lateral or arterial compartment contains the femoral artery and the femoral branch of the genitofemoral nerve. The intermediate or venous compartment contains the femoral vein. The medial or lymphatic compartment is the smallest of all and is known as the femoral canal, which is described below. The deep inguinal lymph nodes lie deep to the deep fascia. These lie medial to upper part of femoral vein and receive lymph from superficial inguinal lymph nodes. Now let's talk about the nerve in the femoral triangle in more detail. The femoral nerve lies lateral to the femoral artery, outside the femoral sheath, in the groove between the iliacus and the psoas major muscles. Its various branches are also found in the femoral triangle. The femoral branch of the genitofemoral nerve occupies the lateral compartment of the femoral sheath along with the femoral artery. It supplies most of the skin over the femoral triangle. The lateral cutaneous nerve of the thigh crosses the lateral angle of the triangle, runs on the lateral side of thigh and ends by dividing into anterior and posterior branches. These supply anterolateral aspect of front of thigh and lateral aspect of gluteal region respectively. So, in the end, the content of the femoral triangle comprises of femoral artery, femoral vein, femoral sheath, femoral nerve, and inguinal lymph nodes. One question remains: what is the adductor canal? Adductor canal is also called the subsartorial canal or Hunter's canal. The adductor canal is an intermuscular space situated on the medial side of the middle one-third of the thigh. As for its extent, the canal is triangular on cross-section and extends from the apex of the femoral triangle above to the tendinous opening in the adductor magnus below. The boundaries of adductor canal are made by muscles. Adductor canal has anterolateral, posteromedial, and medial walls. The anterolateral wall is formed by the vastus medialis. The posteromedial wall or floor is formed by the adductor longus above and the adductor magnus below. The medial wall or roof is formed by a strong fibrous membrane joining the anterolateral and posteromedial walls. The roof is overlapped by the sartorius. The subsartorial plexus of nerves lies on the fibrous roof of the canal under cover of the sartorius. The plexus is formed by branches from the medial cutaneous nerve of the thigh, the saphenous nerve, and the anterior division of the obturator nerve. It supplies the overlying fascia lata and the neighbouring skin. The contents of adductor canal are femoral artery, femoral vein, saphenous nerve, nerve to vastus medialis, and branches anterior and posterior divisions of the obturator nerve. That is all about these two anatomical landmarks of the anterior thigh. Now let's dive in and talk about the structures found in the anterior compartment of the thigh in detail.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.